Okay. We're going to let people trickle in for a minute and then we'll start. Okay. Well, good afternoon and good morning to everyone. Welcome to our webinar called The Farm Bill and Older Adults, sponsored by the Defeat Malnutrition Today Coalition and the National Association of Nutrition and Aging Service Programs. I'm Bob Blancato, and I'm National Coordinator of DMT and Executive Director of NANASP. And I am going to be happy to introduce my colleagues who will be presenting the webinar, leading with Meredith Whitmire, Policy and Advocacy Director for both Defeat Malnutrition Today and NANASP. Laura Borth, a Policy Analyst for both Defeat Malnutrition Today and NANASP. And we're very happy to have Dory Finney from the Senate Aging Committee, a policy aide to Senator Casey and the Senate Aging Committee, who's been very involved in our nutrition bill that we'll talk about later. So welcome, and Meredith, please.
Almost started without unmuting, so think we've gotten that figured out. So wanted to start off talking about the basics of the Farm Bill. I know it's been a topic of conversation in the news a lot, but if you're unfamiliar, the Farm Bill is typically reauthorized about every 5 years or so. The last reauthorization was in 2018, and it didn't have a lot of amendments to the nutrition portion of the bill in that year, but a small change that was very relevant, it turned out. The online purchasing pilot was created. So fun side note there, that became very important during the pandemic just 2 years later. But with the reauthorization comes, of course, debate over the current provisions, debate over potential amendments, changes, and all of that is very important for a successful piece of legislation to continue. The Farm Bill does include farms, but also includes a lot of nutrition. And really, given partisan divides, you need to have both for a bipartisan bill and for a successful bill. And we think that the Farm Bill could be a really key part of achieving the White House Conference national strategy to reduce hunger and improve the nation's nutrition and health. There are a lot of nutrition programs in the Farm Bill, as I said. The nutrition makes up close to 80% of the bill at this point. And some of the programs include SNAP, the food distribution program on Indian reservations, which is very similar to the SNAP program, but for Native Americans. TFAP, the Emergency Food Assistance Program, which works with food banks, CSFP, which also very relevant for older adults. We'll get into some of these others in a few slides, but just wanted to kind of point out there's a lot going on in the Farm Bill beyond SNAP. Next slide, please. So ultimately, this year, the Farm Bill seems to be a big referendum on SNAP. It's grown because it's a safety net program, and there's contention over the update to the Thrifty Food Plan, which turned out to raise the monthly benefit, and that was done via executive action. That happened because so SNAP benefits are based on a food plan. They're based on how much it might cost to eat healthily. However, the food cost, the amount that SNAP beneficiaries were receiving in order to hopefully eat a healthy diet had not increased quickly enough with nutrition. So with nutrition and with inflation. So they ultimately ended up raising the monthly benefit recently, and that has been a huge point of contention. There's been also discussions around expanding work requirements for older adults, typically not the under 65 population, but that would still be a giant increase from current work requirements, which are capped at 50 for able-bodied adults without dependents. We've also had some hearings beginning. It's definitely shaping up to be a battle. Headed into the Farm Bill was the sunset of the extra SNAP pandemic funding, which had provided a lot of benefits for older adults and other populations that didn't receive much in the way of benefits. So minimum benefits for older adults were cut from $250 to $23 a month. Not exactly a lot of money for funding your entire food budget for a month. And ultimately, the food you can buy with $23 a month is not very healthy. And we're concerned that this will impact malnutrition rates.
So,
Yes, Laura, please.
a central goal of SNAP is to alleviate hunger and malnutrition by increasing resources for the purchase of food. And yet, if you can see from this data from FRAC, which is a little old, from 2015, and it showed that only 42% of eligible older adults use SNAP. And even in 2019, this number reached 48%, so still less than half of those who are eligible. And this is terribly low compared to all SNAP eligible people, which is at 83%. And so there's many barriers, stigma, low benefits. It might be, people might not consider the paperwork worth it for $23 a month. But increasing SNAP enrollment could decrease malnutrition among older adults. Something that was interesting for me to learn is that SNAP has one of the most rigorous eligibility determination systems of any federal benefit program. So you can only imagine that that is a barrier to participation. And something about SNAP participation that is important for older adults is that there's a medical cost deduction. So there is a need for education to older adults to educate them that they actually do qualify for SNAP because of their high medical costs. So as Meredith had gotten into, the Farm Bill is not only SNAP. And so a couple of these are actually older adult focused, the Commodity Supplemental Food Program and the Seniors Farmers Market Nutrition Program. And then the other programs are for all ages, the Community Food Projects, the Gus Schumacher Nutrition Incentive Program. This gives grants for fruits and vegetable programs. And then TFAP happens in emergency areas during emergency situations, and food banks receive extra food to give out to people in need. So in the debate about SNAP, there was a poll done recently in February asking what Americans actually think about SNAP. You know, it's one thing to hear what the politicians have decided, but Americans actually have a favorable view of SNAP, about 67% of them. And if you look at this graph on your left, it splits adult citizens into Democrats and Republicans. But you'll see even 40% of US adults believe this program should be given more funding. And that's not quite as strong for the temporary assistance for needy families, but you know, SNAP has strong support. And then Americans are split on whether eligibility requirements should be more or less strict. So looking here, no change to not sure to less strict is still a majority of US adults. So it's always important to keep in mind what the Americans want in their programs. So even though we're only a few months into the new Congress, there have been many SNAP bills introduced. Some of them add work requirements, like in the Republican debt ceiling bill. And then there's a few other get to work type bills that would expand these work requirements to 60 or even 65 years old. And so what that would look like is there'd be a 20-hour a week, for example, requirement of working or volunteering every week in order to be eligible for SNAP, even if you've retired, which by 65, many people may have. There are bills introduced that expand access to drug felons, those that just eliminate work requirements, making it easier to participate, adding college students, adding Puerto Rico into SNAP instead of the SNAP adjacent program it currently has. And then there's some that seek to somewhat overhaul SNAP in general, switching to a more realistic plan to base benefits off of, and just generally making it easier to participate in the program. So I'm now going to pass this over to Dory, who's going to talk about one of the most important SNAP-related bills that's been introduced.
Thanks, Laura. Appreciate it. And thank you, Bob and Meredith, for inviting me here to discuss the Senior Hunger Prevention Act. Also do want to thank NANASP and Defeat Malnutrition Today for supporting our bill, and then for the other, quite a few other organizations that also supported the bill. So in March, we introduced, this bill. We think it's quite comprehensive. It was introduced alongside several of our Democratic aging members. So it was co-led by Senators Gillibrand and Fetterman, sponsored by Senators Blumenthal and Kelly and Warren. And this bill was drafted with the intention of strengthening federal nutrition assistance programs, primarily the programs that are authorized within the Farm Bill. We also wanted to improve access to these programs for older adults, adults with disabilities, and grand families and kinship families. So the programs that are included in this bill are SNAP, CSFP, and the Senior Farmers Market Nutrition Program. So we like to think that there are four main, broad objectives for this bill. So the first one was to enhance benefit sufficiency. Second one was to streamline program access, bolster, cross enrollment, and then improve targeted outreach. So we've been talking about the Farm Bill. We know that reauthorization is coming up. We also know that we're definitely going to be on the defense, especially with a lot of the proposals that have recently come out. So the Democrats very much are going to be trying to preserve these vital programs. So we're realistic about the prospects of this particular bill. But we do think that this bill and other bills that have been introduced are, a good response to some of the proposals that are suggesting that we should, include more work requirements or limit access or cut benefits. And we know that, as you all mentioned, that this is particularly harmful for older adults. That being said, we know we'll be on the defense, but we are hopeful that some of these provisions may be able to be pulled out. And at the very least, our bill ensures older adults, adults with disabilities, grand families, and kinship families will at least have a seat at the table and will, be considered throughout the Farm Bill negotiations. So if you want to go to the next slide, I'll kind of go through the bill a little bit more. But this slide lays out the bill pretty well. I'm just going to kind of talk about these things in a little bit more detail. Some of the provisions, the bill is about older adults, adults with disabilities, and grand families and kinship families. But primarily, it would ensure that these populations can stay enrolled in these programs for longer. So stay enrolled in SNAP, Senior Farmers Market Nutrition Program, and the Commodity Supplemental Food Program for up to 36 months. It also enhances the standard medical expense deduction. So it eliminates that $35 per month minimum on excess medical expenses and instead just allows participants to deduct the $155 for allowable medical expenses. It also, this is kind of in response to the emergency allotments expiring, but it increases the minimum benefit amount for SNAP recipients to 1/3 of the Thrifty Food Plan, which, as you can see here, comes to about $95 per 1 to 2 person household. That's for all SNAP recipients. And then it also would simplify, the application process for eligible older adults and adults with disability by codifying 2 demonstration projects. So the first one is the Elderly Simplified Application Project. So this is a demonstration project that a handful of states currently use, they currently employ, and it basically allows states to make use of a shortened application for older adults and adults with disabilities. It also waives the recertification interview in-person requirement, and to make it even easier on these populations, it uses data matches to try to reduce some of the client verified information that's required. And then the Combined Application Project, CAP, it's also a state demonstration project. And so this bill would codify that as well. So that basically automatically enrolls people who receive SSI benefits into SNAP. So this is, we think that this will definitely reduce some of the barriers because it ensures that older adults and adults with disabilities who receive SSI don't have to go to a SNAP office to enroll. It also has a simplified application, and it uses standard benefit amounts. So, typically that often provides these recipients with more than the minimum amount. Of course, here it says establish a pilot program to provide grants to raise awareness of SNAP. So the bill has quite a bit of funding to support outreach efforts to enroll more older adults, adults with disabilities, and grand families in these programs. We know that their enrollment is really low. And then it would support food delivery through SNAP, through public-private partnerships. And then ultimately it increases the funding for CSFP and the Senior Farmers Market Nutrition Program. We increase the funding because we also expand eligibility to adults with disabilities and raise the income limit. I believe for CSFP, it's to 185% of the federal poverty level. And then Senior Farmers Market Nutrition Program, I believe, is 200% is what the legislation says. So that's a lot. We do think this bill is comprehensive, but we know it's not all encompassing. And we know that there's definitely room for some additional legislative action throughout this Congress. So we plan to continue to work on senior nutrition and, nutrition that affects adults with disabilities throughout the 118th. And then that being said, we touched on the Farm Bill process in the beginning. And so just to provide some updates from our end, which you may already all be aware, but Senator Stabenow, who's the chair of the Senate Agriculture Committee, basically has indicated to members at this point that the goal would be to mark up the Senate's version of the Farm Bill before the end of the summer or right after August recess. So the Farm Bill expires, the 2018 Farm Bill expires on September 30th. So we'd actually need to have a draft of the Farm Bill by June 15th at the latest. So, end of April, beginning of May, all of May really is going to be a very active time. So definitely reach out to your members if there's priorities that you would like them to include. And then last week, we have started the subcommittee hearing. So last week was the one on nutrition, and Senator Fetterman, who is a co-lead on our bill, is the chair of that subcommittee. And he has indicated to the Democratic members that his office will be reaching out soon for their priorities. This week, we also have another hearing, and next week, another one, and then May 17th, I think, will be the last one. So we are moving through this process. And if anyone has any questions, let me know, but that's the update on the Farm Bill for now.
Right. Dory, thank you very much. And I would point out to everyone that this is not new for Senator Casey. He's been on these issues for a number of years. And the timing of his bill this time is particularly important to establish that benchmark of getting older adults into this conversation and into this bill. So Meredith, well, I guess we go back to you.
Yeah, so this basically summarizes exactly what was just said, that the Farm Bill, is determined by the agriculture committees on each side of Congress. So on the Senate side, you have Chair Stabenow, Ranking Member Boozman. Subcommittee on Nutrition is, as Dory just said, Senator Fetterman and Ranking Member Braun, who incidentally is also the ranking member of the Senate Aging Committee. So we should definitely all be reaching out to him in particular, because he's kind of got the older adult angle, older adult nutrition angle on both sides. So. And then on the House side, Chair Thompson and Ranking Member David Scott. And we're asking that you communicate your priorities to both your own members of Congress and also to reach out to these members as well. But with advocacy, ultimately, all we control is our message. So we should be focusing on impacts on individuals and overall communities using data and stories. We need to stay on message, try to build support, and remember that for many folks, SNAP is not just supplemental nutrition, it is everything. We have links here, and we'll be posting the slides, finding how to find your representatives in Congress, how to sign a pledge, ways to spread the news via FRAC's advocacy website. And as Bob has added, we are hoping to find farmers to join us in advocacy, because partnering with the agriculture side of the Farm Bill is becoming increasingly important.
Okay, so we will leave this slide up for folks to get more information, and these slides will be available. And I'll make one or two quick comments, and then we welcome you to join the conversation either in a chat or Q&A. I think it's safe to say that the Farm Bill is the focal point for this year relative to domestic policy, and it is up to each individual advocacy concern to raise their issue and to get it into this bill. That's the same way the White House Conference was operated. It was ageless across the board, but it became an opportunity for advocates to come in and show why this particular program is important for children, for adults, for families, and for older adults. And our purpose today is to keep reinforcing the significance of older adults in this conversation. I think the other thing that's important too is, while we update data and stories, it's important to be as bipartisan as possible in your outreach, okay? Because many of you come from states with delegations that are both Republican and Democrats. They all need to be educated, okay? We shouldn't assume anybody should be left out, because, when you make a local issue, it changes the dynamics, okay? Every senator, as Dory can attest, every senator sees a whole bunch of people in Washington every week. Okay, but when they go home and hear the same issue raised at the Rotary Club, the town hall, whatever it may be, then all of a sudden it sort of sticks a little bit longer in their mind. So that's what we want people to do and to think about, is how to translate this, localize and humanize this very complicated bill into what it means at home. So with that, who would like to offer a question? I don't know whether we have the technique to do it other than Q&A or chat. Laura, what's the deal here? I don't know.
I can allow anybody to talk.
Okay.
So if anybody would like to talk, they can say something in the chat, and I will take you off mute.
Right. And I looked at the attendee. I know there's some people who are definitely capable of talking. The question is, will they? In the 5 minutes we have left in this webinar. Because, you know, you got to remember, when people don't ask questions during webinars, then you leave the host with the impression that they gave you all the information you could possibly ask for. Okay, there's nothing left to talk about. And if that's the case, then we're very happy that we accomplished that. But if there's any additional perspective people want to throw in, this is the time to do it.
Can I just add something, Bob, while we're waiting for someone?
Yes, Dory, please.
I just wanted to reiterate your point of sharing stories with members of Congress. I think data is really important. That doesn't resonate exactly with every member. So I definitely think if you can get stories, particularly from that member state or district, that's going to be very effective. And also thinking about Senator Braun or Ranking Member Braun in particular, Indiana is a huge focus for him. It's a big priority, anything that benefits Indiana. And he is the chair of that subcommittee and the ranking member of the subcommittee and ranking member of aging. So if anyone is planning to reach out to Senator Braun, please ensure that you're using stories from Indiana. I think it will go much farther. Just wanted to
Great.
put that.
Thank you. Tara, thank you for your question. What is the best way you recommend people stay up to date? Well, I'll start. I mean, I think clearly the two organizations that are hosting this webinar are vehicles for you to follow our activities. We endeavor to provide up-to-date information as you go forward. I would also recommend that you stay in touch with Senate Aging Committee's website and their activities and their hearings. Particularly, they're having these hearings over the coming weeks. You might want to monitor what they're going to cover and see what they add to the conversation. And I also think that, you should use the opportunity, and particularly in your wonderful state of Massachusetts, to, make contact with your own individual member, let them know of your interest in this topic. So those are a couple of ideas. Raymond, yes, thank you. Raymond Beveridge is giving us a resource partner, the Farmers Market Association, as they have in Virginia. So vafma.org. Thank you for that resource, Raymond. Appreciate that. Anybody else? Let's see. Well, there's nothing that says we can't give you back 2 minutes of your time. Everybody's busy on a Monday. So on behalf of Meredith, Laura, and Dory, and our tour and the DMT and NANASP, thank you very much for participating today. And if there's any questions, you see our contact information at the very bottom. We'll keep this slide up for 30 more seconds in case you want to contact any one of us, and we'll be happy to follow up. So with that, have a good day, everybody.
Yeah. Bye,
Thank
everyone.
you.
Bye, everyone. Thank you.